Let's start to the second part of our presentation, that is about Crimean-Congo Haemorrhagic Fever. Let's start with the learning objectives that we have. We would like that by the end of this session, you would be able to describe the clinical symptoms and transmission of Crimean-Congo Haemorrhagic Fever. We would also like you to be able to list four major preventive and control measures, and to describe the areas where CCHF is a public health concern, obviously uh, in context of Pakistan. Congo hemorrhagic fever is a viral fever, in short CCHF, or VHF, the viral hemorrhagic fever, and that mainly occurs in Africa, Balkans, Middle East, Asia, and basically in countries in Europe, Africa, and other countries and other similar countries. The principal reservoir of Congo hemorrhagic fever virus is the ticks, or the tick of the genus Hyaloma, the which are insects. These ticks means insects, and ticks of the other tick genera can also be infected with CCHF virus. That is not only the tick Hyaloma, but of the other genus ticks can also be infested with uh, the CCHF virus. CCHF virus and can transmit is transmitted to humans mainly by tick bite or through contact with infected animal blood or tissues during or immediately after slaughtering the animals, notably the livestock, cows, goats. Uh, these are the main things. You should note that 88% of the people infected will have subclinical or asymptomatic presentation. So that means 1 in 8 people will develop a severe disease. 3 billion people are at risk of CCHF in all these countries that we have discussed that we have named above, and it's estimated that around 10,000 to 15,000 infections of CCHF occurs every year, including around 500 deaths. The mode of transmission of CCHF is described in this picture, and you can see three parts in the picture. The reservoir and the natural cycle is between ticks and a lot of different vertebrae like birds, small mammals in the wild, and also from time to time domestic animals. That could be ostriches, cattle, camels, or sheep. Then the ticks feed on the different animal and from time to time bite humans. So the humans are primarily infected by tick bites, most of them. But some people are also exposed to blood or tissue infected with CCHF virus during the cycle of the this transmission. So uh, uh, there's a transmission between humans and CCHF, and this transmission occurs through the direct contact with the blood, the secretions, the organs, and other body fluids of infected persons, notably during direct patient care or during funerals. So it has the potential to infect persons if we are attending, or if we are involved in the funeral of the affected person. So the secondary human to human transmission accounts for 10 to 20% of our human cases, and the primary infections through tick bite or exposure to livestock accounts for 80 to 90% of the cases. The symptoms of CCHF are very broad, like, and it depends on the incubation period. Also, as we know, uh, that 70% of CCHF uh, have a history of tick bite, and 88% of infections are subclinical, as we have discussed in the previous slide. But the case fatality ratio is about 40%, which is quite considerable in the hospitalized patient with severe presentation. And the symptoms that include are the abrupt onset of fever, chills, shudders, myalgias, headaches, sickness and vomitings, abdominal pain, arthralgias, and after a few days, bleeding from the mucous membranes, hematomas, ecchymosis, melena, hematuria, nose bleeding, vaginal bleeding, bradycardia, thrombocytopenia, leukopenia. You see all the manifestations of hemorrhages. And basically, these are the microvasculature that results in all these signs and symptoms. The symptoms of are non-specific, are very broad. You can't pinpoint that this hematuria is because of CCHF. So it's very difficult just on the clinical presentation to be able to diagnose Crimean-Hemorrhagic fever. Your differential diagnosis would include other viral hemorrhagic fevers, but also malaria, typhoid fever, shigellosis, and other viral and bacterial diseases. So, as I was mentioning before, you need really, in a suspicion of CCHF, to have the patient's history. The history is very, very, very important. It's essential to ask the patient about possible exposure to ticks or what are the other sources, the wild animals or the livestock, and exposure of the patient, whether he has visited or she has visited to the CCHF endemic zones or CCHF cases. These are very important considerations. So the laboratory will be essential to confirm you to confirm CCHF suspect cases. Notably, you need to use tests and an assay of transcriptase, reverse transcriptase polymerase chain reaction assay. What that is the and what it usually do, it increases the quantity of the antigen detection and the viral load, right? And you also have on antibody IgG and IgM tests by ELISA that are available and that can be used to diagnose CCHF antibodies, but usually they are but usually they are positive after a week or so. And I would like to CCHF cases requires suitably equipped laboratories and maximum containment conditions so that staff collecting the samples could should be appropriately trained and equipped. You see the last point that the staff, this is in bold, that the handling and processing specimen requires suitably equipped laboratory under maximum biological containment conditions, and staff should be trained, because if the staff is not trained, or if the laboratory containment, laboratory condition, laboratory protocols are not good, then there is a very high chance of getting these lab personnel getting infected or infested with the ticks and spread dengue virus and the spread of the dengue virus. Uh, as far as the treatment of this dengue fever is concerned, uh, the we should know that it should be very early and aggressive and intensive. One need to monitor the fluids, but also the electrolyte balance and the renal function, the blood pressure, oxygenation, and also be very careful regarding the rehydration, the support of the coagulation system. You must be very appreciative of the fact that the coagulation system is at is at the highest risk with blood component therapy has been used successfully in many countries. The supportive drug therapy includes like always antiemetic, painkillers, anxiolytics, antibiotics, antimalarial drugs, and the antiviral drug, which is commonly used is I think that's ribavirin. It can also be given early in the course of disease, and it has shown some response, a positive response, if given early in the treatment. and giving it late will show no response and it will not be effective, and it does not have the potential for surviving in the survival of the patients. So, and also during the treatment, suggestive that we should not give the blood thinners or the painkillers, the NSAIDs, because it will increase the tendency of bleeding. So, what are the key components of the CCHF control? First and foremost, as depicted at the center of the picture, is the national leadership. In the a strong national leadership is required to coordinate CCHF control operation and activities. We also need to be careful for the patients of CCHF, so we need to create, if they do not exist, or to strengthen CCHF treatment centers. They should not be mingled with the other health centers. It will be important as well as to investigate the severe cases who are infected by CCHF, because we need to confirm the exposure of these cases. Are they due to the exposure to tick or to domestic animal? Or are these CCHF cases due to human transmission? It's important to understand these pattern of transmission because CCHF, like many viruses, is evolving. There is genetic change, and maybe tomorrow other strains of this virus could emerge that may be more suitable for human to human transmission, and we need to be prepared for that. But we need to investigate that. The general strategy to control CCHF outbreaks is common to many disease outbreak responses, like what we have heard about, what we have read about is the uh, dengue fever outbreak and others. It's based on four pillars: clinical management, epidemiology, surveillance and laboratory, behavioral and social intervention, and logistics. Logistics because we need all the support in terms of man, material to achieve our goal. All these pillars being coordinated by a strong coordination body. So it's important. It's important to engage early in the community during CCHF season to promote desired health practices and behaviors, including reduction of tick exposure and meat preparation. This is essential. In our setting, the main festival or the period is the Eid al-Adha, during which a lot of slaughtering gets done, and there are very high chances of getting this type of hemorrhagic fever. This is essential if you want to mitigate the impact of uh, like the impact of control operation. We need to provide accurate and timely health advice to the population with the information. The information is power. We can have a change in the way people are exposed to ticks, and we can decrease the number of people who are infected. You can see in this picture the size of the larvae, nymphs, and adult of Hyloba. You can appreciate that they are quite small compared to a thumb. One can use this kind of picture to explain to the population that what we are talking about, because for them these kinds of small animals, sometimes people don't realize they can carry different types of viruses including CCHF. Now, how to reduce tick to human transmission? It's important that you understand very clearly in this part of the presentation, because if you understand well how to decrease the tick to human transmission, you are going to help enormously in the community where CCHF is occurring. So you need to avoid ticks infested. First, you need to avoid ticks infested area that people know these, where the people know that these kinds of ticks are there. You have to wear light colored clothing on which you will see the text physically when they come on you looking for blood. It's advisable to wear trousers, uh, long trousers, and tuck your pant legs into your socks so that ticks cannot crawl up inside your pant leg. Another possibility is to use pyrethroid anti-tick treatment for clothing. It is advisable in most of the countries affected by CCHF. You can also use DEET on the skin. You can or permethrin, notably in the boots and your clothing. And it's advisable in the zones where CCHF is common. It is advisable to perform daily tick checks to regularly examine the clothes and skin in the search of ticks. You need to reduce the ticks in the environment. If you want to control CCHF, you need to control ticks in the environment. You need to reduce them with different insecticide in farms or in livestock production facilities by treating the animals so that if you treat the animals with tick killers, then the population of ticks in the animals decreases. Now, how to reduce the human to human transmission of CCHF? It's important to again realize to decrease the human to human transmission, we need to avoid contact with people who are sick with CCHF. That's the primary prevention. And people who have died from CCHF, even a person died of CCHF is a potent source of uh, spread of this infection. We need as a general rule, but more importantly with CCHF, to regularly wash our hands using soap and water or disinfectant. We need to encourage early treatment in the treatment centers. More advisable, seek health advice as soon as possible if someone gets the symptoms like these. First of all, what are the key challenges for CCHF? First of all, it's difficult to control the tick population in the countryside, in the environment. For example, if you talk of Pakistan, then the Balochistan, uh, northern Pakistan, Gilgit, Baltistan, KPK, it's very difficult to control there. Ticks feed on many different animals. They don't need to feed on cattle or sheep or goats. They can really survive on a long time. They can be infectious a long time. So it will be very difficult to control them and to control the environment in the close future. We have seen that it's really difficult to diagnose a patient based on the clinical presentation. You would need a laboratory diagnostic, and a challenge will also be understanding the mode of transmission of CCHF during a CCHF outbreak to be sure that the human to human transmission is not the major source of transmission.